discussing the issues that make Phoenix a world-class city. Now, On the Issues.
Welcome to On the Issues. I'm Phoenix City Councilwoman Kate Gallego. On today's show, you will learn about the Somali American United Council of Arizona and hear from a local woman about her journey to become a foster parent. First, there's a health clinic in Phoenix that is one of a kind in terms of the population it serves. Here to tell us more is Dr. Crista Johnson-Agbakwu, founder and director of the Refugee Women's Health Clinic at Maricopa Integrated Health Systems. Welcome to the show.
Thank you so much for having me.
Can you tell us a little bit about the clinic?
Sure. So the clinic was launched in October of 2008, really in response to the growing needs to serve the ever-increasing refugee population here in the Valley. Many people may not know, but Arizona is one of the leading host states for newly arrived refugees being resettled for humanitarian reasons from around the world. We have a population of over 63,000 who have been resettled here since 1978. And 80% of all refugees are resettled here in Maricopa County. And that makes about 50,000 that we serve here. And so our health system, Maricopa Integrated Health System, has really taken the lead in championing our clinic, because we are the first of its kind here in the state of Arizona, and we're leading the nation in terms of being a model of best practices for refugee women's health. Since we started in 2008, we've been able to grow to now serve over 5,000 refugees since we began, coming from 43 different countries across sub-Saharan Africa, Southeast Asia, and the Middle East, speaking about 36 different languages. Some of our largest populations are from Somalia, Iraq, Burma, otherwise known as Myanmar, and we're having increasing new arrivals from the Democratic Republic of Congo, which has really been ravaged by systemic conflict and rape as a weapon of war. So we have many women who are coming who are survivors of sexual and gender-based violence. So we've created a safe space for refugees where we create an environment that's welcoming. We have a full-time staff of interpreters who we call cultural health navigators, because they are bicultural, they are multilingual, they speak about 13 languages of our most common populations that we serve. And they really are the bridge between our refugee communities and our healthcare system, and helping to bridge some of those gaps to increase access to care and continuity, and really to build trust with our patients. And we've really shown remarkable growth in terms of the impact we've had on some of the known challenges. A lot of these women have not had opportunities to go to school in the countries where they've come from, and have very low literacy, not just in English, but even in their own native language. So we strive to do a lot of work to enhance their literacy using a lot of direct communication, a lot of audiovisual aids, and just really close partnerships with our staff, working to help them understand how to navigate the healthcare system.
Wonderful. We are so lucky to have this one-of-a-kind clinic and to have you in our district.
Thank you.
Can you tell me a little bit about your background and how you came to this work?
Sure. So my parents were also immigrants from Jamaica, and I grew up in Connecticut, where they were very much involved in the community, very socially active, and really responsive to the influx of Caribbean immigrants who were also struggling and adjusting to life in the U.S. And that really had a mark on me from a very young age, and I think that really led me to have a passion for service and for community outreach and mobilization. And throughout my training, when I was a college student at Johns Hopkins University, I had the opportunity to take a course back in 1996 in Women in Pre-Colonial Africa, where I was first introduced to the practice of female genital mutilation, otherwise known as female genital cutting. And that pretty much became the defining moment for what is my current career, in that I was able to spend the semester researching the issues, cultural issues and history around this cultural practice. And then when I went on to medical school in New York at Weill Medical College of Cornell, I was able to work with a nonprofit agency in New York City, doing a lot of community advocacy and education for newly arrived African immigrants who had undergone female genital cutting. And that really is what determined my desire to pursue obstetrics and gynecology. And over the years, I've been able to really build upon my passion to improve advocacy and policy directives around caring for vulnerable populations. And throughout my training, I was able to further hone my skills in conducting research and also engaging communities. My most recent fellowship was a Robert Wood Johnson Clinical Scholars Program out of the University of Michigan, where I was able to work very closely with the Somali immigrant community in Columbus, Ohio. I worked with over 500 women, examining some of the barriers they've experienced in accessing care. And that's what led me to want to launch out on my own to say, okay, I know what the issues are, I know what the challenges are around trust and patient-provider communication and cultural nuances and misunderstandings around genital cutting, and I thought, why don't I try to start a clinic of my own where we can become a best practice model on improving care. And so at Maricopa Integrated Health System, our Department of OBGYN, our chair, Dr. Dean Coonrod, also had a shared vision because they were struggling for years with some of the cultural challenges and barriers around serving this unique population. And so in 2008, we started from the ground up and really building an infrastructure to provide support and improve the quality of care, as well as teach the next generation of physicians, medical students, nursing students, residents in training to become culturally competent and knowledgeable about how to engage in culturally sensitive dialogue with patients so that we can provide quality care, address the language needs, improve their health literacy, and really empower women and support their reproductive health care. And so it's been an amazing journey, and our hospital has been tremendously supportive. And we've made significant milestones in terms of improving and reducing our C-section rate. Our C-section rates are among the lowest that we've seen. And we've been gathering data on the more than 500 deliveries that we've had, and we're showing that women are really coming into care earlier and are really developing better understanding about Western medicine, which is often very foreign. Preventive health, Western medicine is often a very new concept for women and their families, and we're really trying to bridge some of those gaps to really improve their outcomes.
That's wonderful.
Thank you.
Reproductive health is a difficult situation for people, even in a medical system with which they're familiar, so it's fabulous that you're reaching out to people and making what is a difficult time much, much easier. So
thank you.
We are lucky to have you.
Thank you.
Can you tell us a little bit about the Maricopa Integrated Healthcare System, the system that you're a part of?
Yes, so it is the only safety net hospital, public hospital here in the state, and its mission historically has been to serve the underserved population. So it's a very unique niche, and we are the leading teaching hospital in the state. And so there is a responsibility to not only provide excellent quality care to very vulnerable populations, but also to serve as a training ground for health professionals, physicians, nurses, social work, various health fields. And with that teaching environment, there are supervised opportunities for learning with direct hands-on patient care. And our refugee population is a perfect example of that. We've been able to engage many of our OBGYN residents in training in direct projects involving our patients and our surrounding refugee community, which has been a wonderful experience, learning experience for our trainees, as well as for the patients and communities themselves. And so I think we serve a very unique mission, and now we're being recognized nationally for the impact that we're having and the model that other institutions are seeking to replicate in other regions of the country.
I understand you just came back from a national conference.
Yes, it was the North American Refugee Healthcare Conference. It's the 4th annual conference engaging practitioners and providers of refugee health services from a myriad of different disciplines, not only here in America, but in Canada. And we even had visitors from Australia and other international regions of the world. And this really is an annual conference that brings together these various specialties to talk about what are we doing to improve refugee health in an interdisciplinary fashion, whether it's talking about the challenges with pediatric populations, with mental health, PTSD, which is post-traumatic stress disorder, and depression are very huge. Where there are concerns regarding the high number of Bhutanese suicides that are occurring among new arrivals. And then we also look at some of the challenges around women's health. And so over the 3-day conference, there are many different presentations discussing some of these challenges, but also models of care that are working. And I was the keynote speaker for this event, which was a tremendous honor. And I was able to really set the platform for the conference, talking about some of the global challenges, not just here domestically, but on an international base in terms of what's happening in the refugee camp settings, as well as upon resettlement here in the United States, and some of the vulnerabilities women are exposed to and survivors of. So it was an amazing opportunity. Also, there are opportunities for networking with the Centers for Disease Control and the Office of Refugee Resettlement and all of the other major stakeholders who are involved in resettling populations across the United States.
Wonderful.
Yes.
And it's a lot of stakeholders coming together. I'm glad our Phoenix first responders, including our firefighters, are learning more and more about your clinic so that we can make sure that we are getting our residents to the clinic that can help them most. So.
Oh yes, we've had really great partnerships actually with the fire department and paramedics, because a lot of our patients, because of the low language proficiency and literacy, they're not able to call for help if they need to get to the hospital in a timely fashion, say if they're in labor. And so over the years, we've partnered closely with our fire department and paramedics in terms of giving patients little cards that says, I am receiving care at Maricopa Medical Center, please take me there. And if it's safe, often the paramedics are able to bring them to our hospital, which also ensures that continuity of care because we can meet their language needs, we know their history, we have their records, and that has really been instrumental in closing some of those gaps where they might have otherwise not been able to make it to the hospital. So that's a perfect example of our wonderful partnerships that we've had within our community.
Well, it was so good to have you on the show today. Thank you for the hard work that you are doing, and
thank you so much
for all of the women who you've helped.
Thank you.
Coming up next, we will learn about the Somali American United Council of Arizona. Keep watching On the Issues.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
Welcome back to On the Issues. I'm Councilwoman Kate Gallego. We are continuing our focus on Somali refugees in Arizona. Joining me now is the President and CEO of the Somali American United Council of Arizona, Dr. Mohamed Ali Abukar. Thank you for being here.
Thank you so much. And I really feel honored. I'm privileged to be here today in the show, and I thank you for the opportunity.
Wonderful. We appreciate the work you have done on behalf of the Somali community and Arizona as a whole. Could you tell us a little bit about your personal story and how you came to Phoenix?
My background effectively is that I hold several degrees, BS, and for several degrees from Italy and United States, bachelor's, BS, master's degrees from Italy and United States, a certificate of journalism, and a PhD in public administration, emphasis in international extension management. Back home, I was chairman of the national production and general manager of the largest East African program for poverty eradication and food security programs. In 1991, we had the civil war in Somalia. I was not at all willing to participate in that civil war. And 1995, I have been granted political asylum in the United States and then hired by the Utah State University, teaching 4 courses, graduate courses, and advising the department head on international extension management and international development issue. And that is Logan, northern part of Utah. In 2004, while I was shoveling snow just to get my car out of the garage, Logan, northern part of Utah, it's very cold and a lot of snow. While I was shoveling snow just to get my car out of the garage, I had my heart attack, which took me to one bypass. And I've been told to move to a warm place. And I said, where is the warm place close to Utah? I have been told that Phoenix is one of the best, and in 2005 moved to Arizona, Phoenix. When I came here, I have seen the necessity and the importance that my community, they were in need of assistance in their process of resettlement, proper resettlement, and integration and become productive, law-abiding citizen. And that's where effectively I established the Somali American United Council. I'm the founder and president of the Somali American United Council of Arizona.
Can you tell us a little bit about the Somali community in Arizona?
We have really very large community in Arizona, and it is for several years one of the tops arriving refugees, including effectively Somalia, Congo, Bhutanese, Burmese, and Iraqi are the toppest effectively. We have 11,000 Somali refugees, about 5,000 who came straight from the refugee camps, and effectively 6,000 have moved from other states, like myself. I moved from Utah. And here, effectively, most of them are coming from nomadic and semi-nomadic society. As you are aware, Somalians, effectively, 60% are nomads, 20% are resettled farmers, and 20% are urban. So the number of the refugees that came in United States are mostly illiterate in all language. No rule of law in the nomadic area, and in the resettled area, effectively, people are not friend to the law enforcement. So when they are arriving here in United States, they need a lot of support and a lot of help and a lot of education to become productive law-abiding citizen and have a proper resettlement here in United States.
Wonderful. Well, I'm glad you're here to help them. Can you tell us a little bit more about the council and some of your success stories?
Thank you so much. In 2005, that's where we have established the Somali American United Council, and the main goal was effectively to help our refugee here, and in the meantime, heal the wound that have been created by the civil war in Somalia. The civil war in Somalia is in 1991, effectively by a culture of impurity, lack of reconciliation, have resulted to a civil war, Somalian civil war, power struggle based on tribalism, and as everyone is aware that tribalism and religious extremists are always or continuously fueling inter-conflict and struggle for internal power. So most of the people who have suffered these civil war issue, they were the most vulnerable, or the female, and they went through effectively torture, they went through rape, seeing the most closest person to them killed in front of them, and that's where they moved to refugee camps in neighboring country. Even there, they were not feeling safe, and mostly they are affected by post-traumatic stress disorder. They felt effectively freedom and opportunity just when they arrive in the United States. So they have to be guided through all the program. We are, in the Somali American United Council, we are really indeed the catalyst and bridge for our community for the proper process and positiveness and integration with our community. The services that we provide there are case management, translation, job readiness and job placement, education, effective parenting education, ESL classes, citizenship classes, women empowerment program, sewing program, breast cancer outreach program, prevention of the measures for the TB test, with effective educating our people to voluntarily be tested. And then education for proper interaction with the law enforcement and how to build a partnership with the law enforcement. Effectively, the other program that we do, it is senior assistance, youth enrichment and development program, after school tutoring programs, soccer or sports programs. So we are helping our people. When we are talking about the tutoring, effectively, most of the family that arrives here, are coming from nomadic society. And nomadic society, they never been in schooling. And their kids who are 12 years, 13 years, 14 years old, they go straight to higher school. And they have never touched a pen. So the drop rate is very high. And we are establishing our program, in our center, a tutoring program for after school for helping these people to become successful in their educational program.
Wonderful. Thank you so much for joining us today. It's been a pleasure having you. Up next, we will hear the story of one woman's journey to become a foster mother. Keep watching On the Issues. Welcome back to On the Issues. I'm Councilwoman Kate Gallego. Joining me now is Mia Stewart to share her story of becoming a foster parent. Welcome to the show.
Thank you for having me.
We celebrated Foster Parent Awareness Month in May and recognized the 15,000 students in the foster system. Thank you for your work to help address this issue. Could you give us a little bit of your story as a foster parent?
My journey was kind of an impromptu. My relatives were placed in my care in the latter part of 2013, and so therefore that caused me to do the foster caring portion of it as well as the licensing portion all at the same time without any additional training prior to the placements.
And tell us about the experience. Was it a positive one? Do you see opportunities for policymakers to improve?
Oh yes, definitely. There's plenty of room for reinforcement and to make changes. You have to ensure that your heart is ready to receive the children and that you're steadfast on that mission. There are a lot of community resources, faith-based organizations that support the movement and the information provided to foster parents that want to gird up the whole system here in Arizona to ensure that the children are provided for and given a safe haven at the same time.
Do you think the state provides enough resources to foster parents?
They provide resources, but the information pertaining to the route you should take to get the resources is the difficult portion. You have to be able to tap into those resources on your own most of the time, or have different avenues to take to ensure that you can get those different resources. If it's something that's in black and white on paper that you could get a packet, it would be easy. It's like a roadmap, but instead you have to try to tap into different areas and contact different individuals to ensure that you have the information needed.
And can you tell us why do you think it's important for people to become foster parents?
Because it's a way to give back. I am a third-generation foster parent, and I was able to witness my family give back to the community and assist those in need. Not all children will be permanent placements, but it's a wonderful feeling to know that you can assist the family and those children in their time of need just to fill in that gap until the parents or their loved ones can get back on track and receive their children back into their homes. And with so many children out there, and you have individuals like myself that are single but have time and have the heart and have the energy and the resources to do so, it's a blessing to be able to stand there and love someone and provide that care in a time of need.
Wonderful. Well, foster and adoptive parents are true heroes in our community, and thank you for stepping up. For people who can't or who are not ready to become foster parents but who want to support foster parents, is there anything they can do?
Yes, there's boot camps available, like the community walk that we have pertaining to May, which is Foster Care Month. You can come out and assist with tying the ribbons. You can assist throughout the community and Arizona when you have children that want to have tutors. If you're in the educational field, you can become a tutor. If you're an individual that's athletic, you might want to become a sport athletic with them to assist them on the sport end and going to their events as a cheerleader for the kids. You may not necessarily have to become a foster parent, but you can definitely volunteer at different areas where children are available and give the parents a break or that added pat on the back to tell them that it's okay and you have an additional support system here to gird you up in your time of need.
It was a pleasure for me to be part of tying the ribbons on Washington this year, the 15,000 ribbons to recognize 15,000 youth. Can you tell us a little bit about that tradition and what it symbolizes, how it draws attention to the issue?
Well, the ribbons symbolize each child that's in foster care. So when you rode down Jefferson and you saw those ribbons that were placed, that represented that there was a child for each ribbon that was in care, and that there was a family. If they were not placed with the family, they were either in a group home, but they were out-of-home care children. And there's still children out there that need assistance, and it gave you an eye-opener where you could visually see that this is something that is needed. These children, we don't choose our parents just like we don't choose our foster parents, but it's our choices if we open up our homes and our hearts to them. And it's a wonderful thing to be able to give back and see visually how much it is that the help is needed and where it's needed.
There's a lot of youth. It was a very powerful vision of just how many 15,000 is. Well, thank you so much. I really appreciate you joining us here today. Any final words before we break?
My final word is that every child out there deserves an opportunity to have that special hug and that special love. And no one knows what journey you may play in a child's life.
Well, thank you for stepping up and for being a hero for our community. We really have appreciated having you here today.
Well, thank you. It's a pleasure to be here.
That's all the time we have for this month's On the Issues. If you have any questions or comments about the show, please call my office at 602-262-7493 or visit phoenix.gov/District 8. We'll see you next time on The Issues.